Hello guys, in this video we are gonna learn about hip joint. It is also called as coxal joint and it is a type of ball and socket joint. Okay, it's a type of synovial joint. It is multi-axial joint. It permit wide range of movements like flexion, extension, rotation, and abduction, adduction. Okay, and circumduction. Okay, what are all the articulating surfaces? There are two articulating surfaces for hip joint. First is acetabulum of the hip bone. It is deep cup-shaped surface at point of meeting point of three pelvic bones. Okay, and there is a diagram I am mentioning here, which mention acetabular labrum. It is the outer part which is made up of fibrocartilage, and the inner part which is called as acetabular fossa, which contain fat, and this green color which I marked here is acetabular notch, which contain transverse acetabular ligament. Okay, then articular surface is lunate surface, and non-articular surface is acetabular fossa, which is fat filled, and acetabular notch, as I already mentioned, which is connected by the transverse acetabular ligament. This green color marked point is transverse acetabular ligament. Okay, next articulating surface is the head of the femur, which faces medially, and it contains a depression called as fovea capitis. Here, which I marked here in the part of femur, is the fovea capitis, which is present at the center of the head. Okay, and this is the neck of the femur. This is the body of the femur. Okay, what are all the ligaments of the hip joint? There are 7 ligaments of the hip joint. First ligament is capsular ligament, which is also called as joint capsule. It is a strong fibrous capsule enclosing the hip joint. Okay, then its attachment is on hip bone. It is by the transverse acetabular ligament and acetabular labrum. On femur, by the intertrochanteric line and the crest. And what is feature is thick in the front and thin in the back. Its feature is thick in the front and thin in the back. This I have mentioned a small diagram which contains fibrous capsule and mentioning the femur. Okay, next ligament is iliofemoral ligament. It is the strongest ligament. It prevents the backward falling of the trunk while standing, and it is inverted Y-shaped. Okay, what is its attachment? From anterior inferior iliac spine, which is AIIS, to intertrochanteric line, which is IT line. For this I mentioned a small diagram which mentioning the medial thick band, central thin band, and lateral thick band. Medial and lateral are thick and central is thin. Okay, then intertrochanteric line, as I already mentioned, anterior inferior iliac spine, anterior inferior iliac spine to intertrochanteric line. This is anterior inferior iliac spine to intertrochanteric line. This is the iliofemoral ligament. Then again, this is pubofemoral ligament, which we will be seeing in the next ligament concept. This this is pubofemoral ligament, which is triangular ligament where base is attached above and the apex is below located. Okay, then attachment, it is attached with the superior ramus of the pubis or iliopubic ramus to the intertrochanteric line. Then ischiofemoral ligament, it's a weak joint. Okay, weak ligament. It supports the capsule posteriorly, and its location is behind the hip joint, which is back of the hip joint. Okay, then attachment from ischium to the neck of the femur. Its attachment is from the ischium to the neck of the femur. So attachment, I have given a small diagram mentioning the ischium and the neck of the femur. Okay, next ligament is ligamentum teres femoris, which is rounded of femur. Okay, its shape is flat triangular. Its attachment is from the fovea of the femur. As I already said, fovea means it is a small depression on the femur. Okay, to acetabular notch. Okay, then its function is it carries the blood vessel to the head of the femur. Ligamentum teres femoris, it carries the blood vessel to the head of the femur, which means it contain the main blood vessels to the head of the femur, like nutrient artery, etc. Then acetabular labrum, it's a fibrocartilaginous rim on acetabulum. As I already mentioned, it is the outer covering of the acetabulum. Okay, what is its function? Its function is it grasps the head of the femur lightly to hold in the position. Okay, then transverse acetabular ligament, it's a part of the acetabular labrum. Okay, then it is devoid of the cells, so it doesn't contain any cells. And what is its function is, its function is to transmit the vessel to the joint, main vessels, blood vessels. Okay, now we're gonna learn about the stability of the hip joint. The stability is maintained by the four main points. Okay, the first point is length and obliquity of the neck of the femur maintains the stability of the hip joint. Next, ischiofemoral, pubofemoral, and iliofemoral, these three important ligaments supports and strengthen the capsule of the hip joint. Okay, then depth of the acetabulum also gives stability to the hip joint. Next, strength of the surrounding muscles like gluteus medius and gluteus minimus gives stability to the hip joint. Okay, then its relation. There are four relations regarding the hip joint: superior relation, inferior relation, anterior relation, and posterior relation. Superior relation is formed by the gluteus maximus, gluteus medius, gluteus minimus, and reflected head of the rectus femoris. Okay, then for anterior relation, it is formed by the straight head of rectus femoris and a tendon of iliopsoas. Contain vein structures: femoral vein, femoral artery, femoral nerve, and pectineus muscle. And it contains a hip joint contains bursa called as synovial bursa. So there are seven components of the anterior relation. Next, inferior relation is formed only by the obturator internus. Next, posterior relation is formed by the piriformis, gluteus maximus, and obturator internus, and the gemelli like superior gemelli, inferior gemelli, and quadratus femoris. This yellow color marked point is sciatic nerve, and this quadratus femoris is supplied by nerve to quadratus femoris. Okay, next, bursae around the hip joint. There are seven bursae of hip joint, which is four under the gluteus maximus, one under the gluteus medius, one under the gluteus minimus, and one under the psoas tendon. Okay, then artery supply of the hip joint. Artery supply is maintained mainly by the four important arteries like femoral artery, obturator artery, superior gluteal artery, inferior gluteal artery. Femoral artery itself not gives some branches. It's like medial circumflex femoral artery and lateral circumflex femoral artery. For mentioning the artery supply, I have given a small diagram showing acetabular branch for fovea capitis and a retinacular branch and a nutrient artery. Okay. Next is the nerve supply of the hip joint by the femoral nerve, nerve to quadratus femoris, obturator nerve, and twig of the sciatic nerve. As I already mentioned, all four nerves in the relations itself. Then movements of the hip joint like flexion, extension, abduction, adduction, medial rotation, and lateral rotation. These are all the movements produced by the hip joint. So for considering these movements, you should remember at least two muscle which provide each movements like flexion, extension, abduction, adduction, medial rotation, and lateral rotation. Okay, then for everything you have to write applied aspects. For here I have given three applied aspects for hip joint. Whatever you can remember, you write first of all the don't forget to write applied aspects for any question that they have been asked. Okay, so applied aspects here is referred pain of the hip joint is seen in the knee joint. Okay, then fracture neck of the femur is more common. Fracture of the neck of the femur, okay, is more common. Next, neck shaft angle, which is 125-degree in case of adult and 160-degree in case of children. If the angle is reduced, then it is called as coxa vara, and if angle is increased, then it is called as coxa valga. Okay, these are all the applied aspects of the hip joint. So that's all the hip joint. So thank you.